from Cenotech in Mexico. Thank you, Adrian.
Hi, everybody, and thank you, Tom, for this invitation. Glad to be here and share some information and experiences about telemedicine from the perspective of a biomedical engineering side of a Ministry of Health. It is clear that COVID became a catalyzer of the implementation of telehealth. Also, we can see that telehealth service became every day more common. In some cases, it is almost something normal to give medical service using IT. Technological development is a normal process. Innovation is a natural phenomenon, and that affects telehealth as well as many other technologies. People, patients, consumers are looking every day for more service based on IT. Used for being more comfortable, sometimes forget something efficient, and sometimes for a real need. This natural growing, please, we keep in the yes, thank you. This natural growing do not happen by itself. This natural growing, it is the result of a compendium of skill, knowledge, processes, and applied technology, and mainly by a group of people who develop their creativity, imagination, and put knowledge into a practice for the development of technologies that support telehealth services. It is then evident that whoever is prepared to face this change will be able to make better use of the tools and resources available. As in any evolution, whoever adapts more quickly to the change will have a competitive advantage and will offer more benefits to their users and consumers. It is true also that telemedicine and digital health increased considerably with COVID-19 pandemic, but not all institutions have been able to adapt to the changes. However, we are still in a good moment to transform a small step into a great big steps supported by legislators, opinion leaders, decision makers. Without doubt, now telemedicine as a solution is here and now. Next slide, please. One of the areas on telehealth that has grown the most in Mexico, and I believe that in all Latin America, is the interpretation of radiological images. The digitization of this system has allowed easy distribution while maintaining high quality and safety standards. We see radiological information can easily incorporate into hospital information system, but now new change arises, and it is incorporated to the request of doctors or patients from, for example, web pages, or even from application on their smartphone, which is sometimes accompanied by a video call or even from a chat talk. Following the normality of digital transformation and the incorporation of new elements to medical digital system, one of the many challenges now is to incorporate these simple, even inexpensive and accessible elements to a very much more robust model or system with high security and with large work of standardization and consensus, such as the hospital information system. Next slide, please. So, given all these changes, it can be a little bit confusing to follow certain lines of work. International organizations that are expert on these issues, such as the World Health Organization, recommend walking on the path of standardization of process, catalog, message, to seek interoperability between different systems, platforms, and applications. Considering that, even more and more health professionals carry on their own electronic devices or equipment, as well as patients who prefer the information in their own phones and computer. So it is necessary to have multidisciplinary teams with clinical profiles capable to communicate with the population, with the community, personnel who knows about information security, quality of the data, and the information. Finding those profiles has become very complicated. Now, the team, I mean the human resources inside of the hospitals, go far beyond just the doctor and a nurse. Next slide, please. A little more than 15 years ago, I had the opportunity to participate in a telemedicine program. With some trucks adapted, we carry a mobile consulting room in the back. We used to visit some small town located in the south part of my country. Communities located in mountains and places hardly accessible. Through a satellite connection, we were able to communicate student doctors with general practitioners and specialist doctors located in Mexico City. The truck had basic medical equipment in addition to ultrasound, electrocardiograph, equipment for basic blood chemistry tests, and as well as an examination camera, and some other accessories that communicate with an electronic medical record. The experience was fundamental in my professional career. Since then, I have worked into operation of telemedicine programs, the implementation of these programs. Later, I had the opportunity to join the Federal Ministry of Health in my country to support the design, planning, and monitoring of telemedicine and telehealth programs and projects. Like most of the technologies that are incorporated into the health system, there are topics and areas in which technological improvement is required, from refining process, developing electronic interface to facilitate the work of the personnel who attend the patients. Next slide, please. One of the biggest challenges we have faced in the development and operation of telemedicine project has been the integration of several medical devices with information system. In a context of limited economic resources, it is very important to operate the project as quickly as possible in an appropriate way. At that moment, international collaboration became your great ally. Knowing the results of similar experience is one of my recommendations is to establish support networks with other similar organizations in other countries. It is true that the systematic review of scientific information or documents in scientific journals are great help, but the experience of those who have implemented similar projects is invaluable. We create working groups with local telemedicine coordinators. The objective of this workforce was to establish support networks to facilitate the implementation and monitoring and evaluation of the telemedicine projects. Next, please. As projects are implemented, it is very useful to share experience, results, and best practices. Therefore, knowledge management is one of the great pillars, solid foundation of any telemedicine program. Sharing information through webinars, workshops, seminars, discussion tables, and congress are essential to motivate and encourage dialogue between academic, scientific, industry, and caregivers. The digital tools that we currently have allow us to establish a much faster communication. Never underestimate the experience of someone who has already implemented a project. She or she will for sure save you some headache and will help you to establish goals in the shortest possible time. Some of our results are to reduce the waiting time to be seen by a specialist doctor from 6 weeks to 1 week. In particular, for those patients who were in a remote place and far from the big cities. Also, 62–65% of patients of telemedicine programs are fully resolved without the patient having to travel to a second level of care. Next, please. As in the vast majority of countries in the world, we identify technology tools that help us to find relevant information for the fight against COVID-19, like chat support by cognitive assistants, medical guidance phone calls, direct video consultation with the patient, remote monitoring of patients through their mobile phones. Once again, the support of international organizations was essential to adapt remote medical care model for the follow-up of our patients and citizens. And this time, information and communication technologies plays a very important role for communication among health professionals, for the communication of health professionals with patients and patients with their families. Some of our institutions train 100% of their health professionals with action against COVID just because they had projects supported by telemedicine and telehealth. Some other institutions follow up with more than 80 patients daily using video calls. We are still building this ecosystem. We have very good results, and as soon the activities allow us to make a better analysis, we will be able to present results to identify the most efficient practice. Together with institutions in charge of creating laws and regulation, we are working to strengthen the legal framework that support the practice of telehealth in my country. With other organizations, we are incorporating variables that identify the new health actions that use telemedicine and telehealth technology. I mean, official variables, official variables. The industry has moved very fast and offers various solutions such as electronic prescription, personalized electronic and medical records, platform of telemedicine with high standard of safety and quality. Doctors and patients are very convinced that telemedicine is one of the solutions to attend the current pandemic. We understand that it will never be the same as face-to-face. However, we also understand that because low mobility, right now telemedicine represents the only way to get care services for a big percentage of citizens and patients. Next, please. Even with COVID present in our lives, the care of other diseases must continue. We are developing models that allow us to support the resolution capacity of the human resources established in the first level of care. It is evident that we cannot incorporate technology very sophisticated in all first level care medical units, but we can use the infrastructure and resources that allow us to use doctors and patients, seeking to establish continuous, safe, and interoperable communication as much as possible to facilitate communication not only between doctors, but also among all health professionals. Our new models are more focused on better coordination and management of service and information. However, the technology itself represents the first link in this model. And like I did say in the beginning of this talk, the great challenge for engineers is to adequate the world of medical technologies with the world of accessible devices that are in the hands of a good number of citizens. Well, I mean a big number of citizens. Next, please. Digital health telemedicine, telehealth is strongly present inside of our health institution. Citizens, patients, consumers demand more and more service support by this type of technology. The right question is not to identify if telemedicine will become part essential of the service of any health institution. The question should rather seek the answer in relation to how long that institution will be able to provide service based on IT that allow the care of patients remotely, with security of the information, integrity of data, and interoperability that use information in different systems and platforms. The team, human resource, must be multidisciplinary. Doctors who know about technologies, I mean medical doctors who know about technologies, physicians that know about technologies, and engineers that understand very well the medical process. I appreciate your time and the attention you pay to this talk. There are many things that need to be done. Information that we can share among all. The situation are very similar and we all face common troubles. Please continue talking. Please continue with the debate and with the aim to improve access and quality of care for our patients and citizens. My name is Adrian Pacheco. Thank you all.
Thank you so much, Adrian. Great job.